Welcome back to another episode of Meredyth with a Y. I am your host, Meredyth Willits, and today I have on a plastic surgeon, which is so appropriate because I just had a tummy tuck a month ago, Dr. Daniel Kaufman. He is a board-certified plastic surgeon who represents the highest standard of care in the field with a master's in biomedical engineering and a passion for cutting-edge technology. He bridges the worlds of medicine and aesthetics with visionary skill. And today we are talking about loose skin after all of these GLP-1s, Wegovy, and all the things. So stay with me. Hello, everyone. This is Meredyth with a Y, and I am your host, Meredyth Willits. Today we are going to go deep, changing lives, and I am giving you the keys to the castle. Good morning. I'm so excited to have you here to talk about all things plastic surgery.
Morning.
This is so good. I already have questions from people that knew you were going to be on today, and I am one of them. Like I said, I just got a tummy tuck 1 month ago. I'm in my faja right now, which I wish I would have found 2 weeks ago. Looping. There we go. And I wish I would have found it 4 weeks ago because I was wearing one of these binders.
Oh, geez.
And it's like coming out. They're horrible. The faja is so much more comfortable. I wish I would have known. So you're probably seeing, you said you actually just finished your first case this morning. You've already been in surgery today. You've got to be seeing.
Tummy tuck, actually. Funny enough.
Stop it. You have to be seeing so many patients with all this loose skin, and people are dropping hundreds of, tens of pounds all over the place with all these new meds, which is great. But then they're left with skin that won't go anywhere. So can we talk a little bit about that?
Yeah. And it's not only, funny enough that the Ozempic craze and Wegovy and all the GLP-1s are coming around recently, but it's been around for a little bit of time already because we've already been doing a lot of bariatric surgery. Now there's a new revolution in surgical or bariatric endoscopy, which is weight loss with a procedure which is endoscopy rather than bariatric surgery. So there are people coming around with all kinds of loose, sagging, surplus skin, not only in the abdomen, but around the backside, the arms, the thighs, the breasts, the neck, you name it. Loose skin is everywhere. This is the new frontier in plastic surgery. And it's amazing that it's coming around now because it's such a perfect combination of all of plastics, all of what encompasses true plastic surgery, which is a combination of cosmetic and reconstructive. So taking care of all that loose skin is it's a joy for me, and it just restores people's confidence and just I've seen people grow so much, and I'm kind of at the back end of treating obesity, which is the biggest medical problem the world has ever known. Yeah, there's a lot of work to do.
Well, and I talk about that. My husband, he works in sports, and we've got these beautiful like photographs of like back in the 20s and 30s at the White Sox field, and everyone's thin. Like everyone has the tiny, tiny waist. They're dressed to the nines, but there's not one person that's overweight in there. And I think so many people want to be like, you're lazy, you eat too much. And I think a lot of it is we're just eating and I've had so many people on this podcast, we are eating what the world tells us is food. Yeah. And it's backfiring on us painfully. Like I try to eat things that like when you look at it, you go, okay, I know where that came from. I know what that is. But recently I've been on this thing where I'm like paying attention. I'm like, outside of the word like fruit juice, everything that I would put in my mouth if I ate this is chemicals. But we're told it's food, and then we are blamed because of the fact that we're getting fatter and fatter and fatter. And it's just this horrible cycle that we're in the United States, especially that we're eating chemicals, which are hormone disruptors, which then cause us to have our sugar out of whack and our bodies are out of control. And we really are, I don't want to say a victim, because, we can always, I mean, even if I just looked at my brain and it was like, eat chicken. And it's just like, wait, the chicken's even tainted. And so like you're here and the medical professionals are here. I think we need to front end this. I know you're the back end, but we need to front end this and say, hey, what can we do to not get there? But you're here to help once it's already gone south. For me, I stood in front of my plastic surgeon and she goes, this thing right here, the bottom of my stomach, she goes, this ain't going away. She goes, everything looks great. I have abs, but this right here, this little flap, I don't care what you do, this is going to stay. And that is what caused me to make the decision to get the tummy cut because of that. Like, she's like, you could literally be anorexic and this will still flap down. And after 4 kids, the last one was 10 pounds. And I think a lot of, I know, Brock. A lot of women, especially, we're at the mercy of having children and what that can do to our bodies. And I'm sure you've seen that, not just being overweight, but just having babies.
Yeah, I mean, it's we touched on a lot of things.
I know.
There.
I'm sorry, I went on.
I wanted to go on all these different.
I know
there, but I'll take the last one that you're saying. Yeah, look, plastic surgery. It's so often kind of people judge it, but it's vanity. It's you're doing this because of some kind of ulterior motive of trying to I don't know, compare yourself to some ideal. But so often I see people who are just struggling with just these things that really don't go away. As you said, there's no exercise or pill to make that extra loose skin go away. Now, women, on top of the weight loss that we're experiencing in massive amounts now, which is great to see. Obviously, with the epidemic of obesity, it's rampant right now. But women specifically face the challenges of after birth. You got that mommy pouch, the kangaroo pouch, whatever the name is. You name it. You can't embarrass me anymore with these nicknames. But it's touching to see how I get to talk to people and they reveal all their deepest kind of intimate insecurities about themselves. And for women specifically, childbirth and nursing, with the way that the number that pregnancy does on your breasts. I mean, there's so many things that hit a person's confidence, and it really takes them out of the game. It really pushes them backwards in their life and their what they're able to achieve on a day-to-day basis, and kind of just being themselves. And I find that plastic surgery is so often, vilified in one way, but the way I see it, it's an absolutely integral part of healthcare, because it helps out so much in restoring people's confidence and self-esteem, and dare I say, mental sanity. Getting back to those pre-obesity, pre-child contours. It just restores your soul. And for me, it's you're never going to convince me otherwise. I love plastic surgery, and I think it's definitely a part of healthcare, and it's here to stay.
Well, I will tell you. So when they went in, I didn't even think I had that spreading of the muscle situation. Like, it wasn't even on my radar. Diastasis. I've always worked out since I've been 14 years old. It was my escape, lifting weights, working out like a mad woman. And so it was like never on my radar, because it's so gradual with having 4 children. And I said, so did I have one of those things? I asked my surgeon. She goes, and I go, how? And she's like, yeah. And I go, how bad was it? She goes, well, I guess I've seen worse. What? I'm like, what? Like, what does that mean? She's like, it was probably about 3+ inches. What?
Not bad. I've seen worse.
I'm sure you have. So, but now when I like feel my stomach, like inside of my body, it's so much tighter. It's like, I don't even know how to describe it. Like sitting up in bed I'm not even fully healed, but even sitting up in bed, I feel more together. I know that sounds weird, but it's true. Now, a year ago, I had breast reconstruction surgery from breast cancer, and we did a lift and fat grafting, which I know some doctors do and some doctors don't. Mine does, thank God.
I love it. Love to do it.
Yeah, because I'm like the type of person that, like, I had a belly button piercing when I was in college, and I got a fever, and I was like, oh, it's definitely the belly button piercing. I got to get it taken out. So I just knew I wasn't like a great mental candidate for implants. That's me. So I knew like fat, I wouldn't be like, oh my God, get it out. It's making me sick. That's just me. I just knew that I was going to be better with fat grafting. Anyways, breastfed all 4 of my kids. Every time I got out of the shower, there's a mirror right outside my shower door. You just look in the mirror after 4 kids and you're like, I look like death. This is awful. This is me, my opinion about my body. Now I get out of the shower and I'm like, damn, those are some 19-year-old boobs right there. Like, I feel so good about myself. I'm like, I feel like lighter. I feel happier. I put on clothes. It feels like $1,000,000. I could put on a sundress and I'm not dealing with sticky bras and trying to make magic out of whatever the hell happened after, decades of breastfeeding. And I just, like, I tell everyone, I tell everyone, number one life-changing surgery was getting a breast lift. There is nothing like it. You cannot convince me that it's not worth every penny that is charged. It has literally changed my life. Breast lift changed my life, period. I game changer.
So the cancer surgery saved your life, but the reconstructive surgery gave you back your life.
1,000%.
This is what I tell people all the time. Plastic surgery is just, it's an integral part of healthcare. It's just, can't be discounted. And
my insurance covered it.
Wow.
Yeah, my insurance covered it because I had asymmetry from having the lumpectomy. So because of the asymmetry, I think that insurance has to cover it as long as they can show that it's like some sort of asymmetry because of the lumpectomy.
And related to the cancer, then yes, there are laws for that. Correct.
Correct. And so like if you're out there and you had some sort of like lumpectomy or anything like that, I will tell you, go to your plastic surgeon and ask if you can get it covered because it has changed they were able to completely hide my scar into my areola. I mean, awesome. I know this is way too much TMI. I don't care. But to not have to look at that breast cancer scar every day and think, I'm sick, I'm dying, look at that, I'm maimed. It literally changed my mental health, like 1,000% to not have to look at that. However, I have a few questions from people that knew you were going to be here today. And this has to do with sagging skin. So this person asked, can you let us know, do you advise people if they've lost, like, let's say 100 pounds? So they have loose skin everywhere. So we're talking about someone who has arms, legs, stomach, boobs, the whole 9 yards. Mm-hmm. Do you suggest this be done all at once or in stages?
Right. So what you're saying right now, that happens all the time. When you lose a massive amount of weight, and what that is defined as these days is 100 pounds or more of your body weight, or 40% of your total body weight that's lost. These days, a lot of surgeons like myself, we even consider 50 pounds or more as massive weight loss because, there's going to be sagging skin in every part of the body. And it's a circumferential problem along the limbs, arms, thighs, around the back, everywhere and anywhere you're going to have loose skin. So, yes, there are the surgeons who do these massive commando style operations where they do a total body lift and the breast lift and implants and arm lifts and thigh lifts. That's not my preferred way. And honestly, I don't think that's the proper way to do it. There's a few reasons why that is. A staged surgical plan is the best way to go for a few reasons. Number one, it's safer, right? Because you're not doing everything all at once and you're not condemning the patient to a hospital stay, which absolutely has to happen when you're doing so much surgery at once. You're talking about massive blood loss. You're talking about potential for blood clots, which could be devastating, the pulmonary embolism that could happen, and a bunch of other things. And, it really takes you out for a prolonged period of time out of your life. So doing things in bite-sized chunks is the best way to go, number one, first and foremost, for safety reasons. Another reason is from financial perspective. It's easier to do small stages where you pick the worst body part, which is what I always ask. Okay, what's the worst body part I can help you out with? What's the best thing I could do for you? And then you pick at that, you decide how healthy or how physically fit the person is for that surgery, and you do as much as you can in any one surgical episode. Typically, let's say a total body lift, or maybe an FDL belt lipectomy total body lift. And we can go over all the jargon in a moment, right? So again, what you do there is you can pay for that specific operation and then live to fight another day. You can accumulate more money as time moves on. Typically within 6 months to a year, you can advance to the next stage. And then when you stay out of the hospital, that's when all the bills stay down. The hospitals, they're going to charge you a lot of money for those overnight stays and all the superfluous things that don't really need to be there. When you're doing ambulatory surgery, that means surgery you can walk in and walk out of, you're definitely saving a whole bunch of money. So from a cost efficiency perspective, definitely better to do it in a staged manner. And the third reason, which is just as important as the others, what happens after any surgery, everything changes, including your body image, your perception of how your body is. And I'll give you an example. Some women tell me, and I say, okay, what's the worst thing we could do? And they tell me, okay, I hate my abdomen and my butt, and I really, really hate my thighs. And I say, okay, fine. Let's do a total body lift or a belt lipectomy, just going all the way around. We remove a tissue, literally a belt of skin, excess skin and fatty tissue off of your body. And then we just do that, and then come back to me in 6 months, a year, what have you, and we'll do the thighs. And then we end up doing the belt, right? And then they come back to me and I say, okay, ready for the thighs? And then they say to me, you know what, doc? My thighs, they look a lot better after the belt. Now my arms and my breasts, I hate them more than anything. Can we switch it up? In which case I say, absolutely. You see, the body image kind of changes, and you allowed some time for your mind to perceive your body in that new light. And you can adjust, you can change things up, and you can advance in a better way so that you handle your body in a more nuanced kind of perspective when you do it in a staged manner. So it's safer, it's cheaper, and it's better. Staged approach is the way to go.
Yeah, I never would have thought about, like, if you have to stay in the hospital, like, you're paying that hospital stay out of pocket. So that's wild. And I think that, like, I knew that I was going to be in pain, but I didn't quite appreciate how long I would be out of commission. Like, I needed 100% like to be fed and, all that stuff for days. Like, I don't think I came out of my bedroom, like physically even out of the room, for a minimum of 1 week.
And that's only with a tummy tuck. Imagine if you did the arms and the thighs and the breasts. My God.
I probably, because, and I'm going to tell you in the beginning, so I took my pain meds, which was Oxy, I think that's, and a muscle relaxer. And then I had to make sure I didn't take them all at once, because then you could like slow down your breathing, and I don't need that, right? So like I had like alarms going off constantly, and my doctor used a pain pump. I don't know if you use that, but it is.
I have before, the on-cue pain pump, yeah.
Oh my God. What? Because I had to take way less meds because of it. It's amazing. Anyways, you get panicked because you're not coming out of the pain. And so like I was almost kind of taking the meds to like calm myself down, because it's just not even pain. I wasn't even in pain. It's just, you can't move. You roll over to get out of bed. Like, you're in it. You cannot get out of it. Like, you're there, and you have to be okay with being there. It's a bit of a mental game too. Like, you're going to roll out of bed, you're going to shuffle to the bathroom, and you're going to shuffle back, and you're going to lay here and watch Netflix all day. Thank God for Netflix. And like, there's a part of that too that you have to get used to, which is you're not leaving this healing process for a long time. I can't imagine having your entire body done like that and extending the long time to more weeks and more days and more help needed and more pain. Like, even my like second shower, taking a shower, my back hurt so bad from my back having to hold me up instead of my stomach holding me up. Like, I don't think people fully can appreciate being that debilitated for a few days, and how weird that is. And so like, I can't imagine, I mean, like, even thinking about it makes my stomach sick, the idea of having it done all at once. So the person asked if it was done in stages, and you kind of answered this. What would you do first? You said whatever you hate the most.
So there's a few ways to approach this. Number one, you got to remember, this is, after all, elective surgery. So, and we could argue about whether it's cosmetic and reconstructive. I think it combines the elements of both, but it is elective. You choose to do the surgery. You choose what to do, when to do, where to do, with whom to do. So yeah. The best question that a surgeon could ever ask the patient to say, well, what bugs you the most? Because that's where I want to target first. And you have to listen to what your patients are telling you. That's the only way to be a good surgeon, because yeah, you can go on with your own plans, but if the patient doesn't agree with it, well, they're not going to get on your table. So that's the first question I ask. Where is the best body part that I can help you out with? But if they say, well, everything bothers me, my arms, my thighs, and this and that, what do you think, doc? Then I say, okay, best to start from the core of the body, which usually means an extended tummy tuck, let's say, or an FDL, which stands for fleur de lis, just a French word meaning the lotus flower, where we don't only do that smile of an incision of a tummy tuck, or an extended tummy tuck rather, but also add the vertical component. So you're going to have a vertical longitudinal midline scar as well. So those are two options that we can do. Beyond that, if you can withstand it, if you're willing to tolerate the circumferential scar, then we go for a belt lipectomy total body lift. Again, belt meaning a literal belt of tissue. And notice there's a distinction there between liposuction and lipectomy. That's a big thing we have to get across. Is liposuction is just when we do liposuction, we inject fluids into tissues, and then we take our long metal cannulas and we do that famous maneuver. Yeah, I know you're making those faces there, but it's a little brutal, I know. But people love that kind of stuff, by the way. They love to see it. But that's when we're sucking out the fatty tissue. Lipectomy, on the other hand, is when we actually cut with a knife, with a scalpel, of course, we cut out large pieces of skin and soft tissue. So a tummy tuck, an FDL tummy tuck, those would be forms of lipectomy. Now, belt lipectomy just indicates a total body lift. Belt lipectomy could also be made into an FDL belt lipectomy, meaning a circumferential scar around the body. And no, it's not going to be a ring around your waist. It's going to be placed beautifully under the bikini in the front, along the thong line in the back. You can actually hide my scars under a thong bikini. Wow. And maybe add a vertical component to it. But those are some of the best options to start with. There's even more than that, but that's kind of my basic 4 operations at the core of the body: the extended tummy tuck, the FDL extended tummy tuck, the belt lipectomy total body lift, or the FDL belt lipectomy total body lift. If we start there, then we can proceed superiorly into the upper body or inferiorly into the lower body.
Yeah. Well, when I forget when it was, I lost a bunch of weight, probably after my second child. And I had read something, this comes back to you, that your heart has to work so much harder to pump blood to all of the fat. Like all of the extra body that is now you. So if you are 75 pounds overweight, your body, your heart has to pump, your lungs have to work harder to get all of that blood into all of that extra weight that is now you. Can you speak to what it does, or has it even been quantified, how much less hard your body has to work when we do remove all of that skin and tissue and weight? I think it would make it so much less taxing on your heart and your lungs when you remove 50 pounds of flesh.
Absolutely. And not only on your heart and lungs, but every body system and or organ improve after weight loss, and specifically after massive weight loss. So yeah, the hemodynamic needs, hemodynamics, just fancy word, relating to blood pressure, heart rate, things like that affect, essentially the vascular system, the cardiovascular system, the blood and the heart, the way that they have to pump. So yeah, the metabolic needs of fatty tissue, which normally aren't that much, but when they get bigger, they demand a whole bunch of more of what's called your cardiac output, which is what the volume of blood that your heart is able to pump in any 1 minute or other period of time. So when we lose weight, everything improves. Obesity is it's one of those diseases of the 21st century, of course, but then again, it goes back 10,000, tens of thousands of years before that. We've always had obesity in humanity, but it's just been put on steroids the past, couple of decades. But obesity affects all the organ systems in the body. And I mean, you're talking about POCD, lung disease, infertility, osteoarthritis. It affects the bones, the muscles, of course. It just affects everything. And when you improve with your weight, it improves the function of all those different body systems. Your immune system functions better. And anyone who's lost weight will tell you, just on an anecdotal level, it gets easier getting up and down from a seated position. And I can go up and down the stairs a lot easier. And I've had plenty of women. I actually wrote a paper about this like 20 something years ago that women's reproductive abilities actually improve after they lose massive amounts of weight.
Yep.
It's not an unheard story for me to hear about a woman that, she was overweight or obese and she tried IVF and it didn't work for a few years and nothing worked. And then she just decided to take life by the horns and she lost 100 pounds and out of nowhere, boom, she pops out a baby or twins
Yep.
even. So there's
I just had
improvement.
this exact same conversation with an OBGYN, and she said, like, they'll come in for infertility issues. She will tell them, like, look, you need to lose 80, 50, 100 pounds. As soon as you do that, there's a very good chance. She said all the time she has people come in and they lose weight. Now, granted, there are people that, still remain infertile, but she said she will literally, the first step is weight loss when she talks to her patients. So it's interesting that you're talking about that. And, like you said, it's just easier to get around, and my thing, which comes back to you, is you've done all that work. We've seen them all on TikTok, on social media. They've done all the work to lose the weight and they're still plagued by these thighs and the skin that they're tucking into their clothes. And it's
And
like,
arms and breasts.
and you're like, oh my God, you did all that work. You've been walking and you've been lifting weights and you've been watching what you're eating, et cetera. And then you're still plagued with this body that is so out of control and it's so much to deal with. And it's so nice to know that there are surgeries that can help, fix all of that. What is the tipping point of when? So let's say you need to lose 100 pounds. When does someone come see you? Is it at 50 pounds? Is it when they hit their goal weight and maintain it for 8 months? This person that wrote in, they said they have they've gone to 2 doctors and both doctors are like, okay, let's get you on the table today. And then the other doctor was like, okay, tell me when you've maintained for 8 months. So what's your take on that?
Yeah, so I see patients from all across the gamut. I mean, I see them when they're just morbidly obese with BMIs of 40, 50, and even more than that. And a lot of times, they know that they're probably not ready for my kind of surgery yet, but they're looking for some kind of strategy, some kind of, at least, the proverbial light at the end of the tunnel, because they want to know how to get there and when can we actually get on the table. But, you hit on something very important. It's amazing to me. And I've been in, the bariatric surgery, then weight loss, and that whole world of obesity. I've been in there practically since my medical school days. I've done a bunch of research in bariatric surgery and insulin resistance, metabolic syndrome. And, I saw firsthand, I worked with a bunch of bariatric surgeons going through my general surgery residency before my plastic surgery fellowship. And it always struck me to see how many patients are simultaneously so happy and so sad about their weight loss. Some of them even tell me that, they think because of all the loose, sagging folds of skin everywhere and all the attendant problems with it. You're talking about folliculitis, intertrigo, all the bacterial and fungal infections that can happen from, poor hygiene for one reason or another. And it's amazing to see how they know that they're much healthier after the weight loss, but they're still so sad about it. Some of them even tell me that, it was a bad idea to lose the weight altogether because of all this persistent poor body image. They look in the mirror and they're reminded constantly of the obese state because of all the loose, sagging skin everywhere. So it's just, and it's sad to see because, like you said, they've done so much. They've worked so hard. They've conquered so much in their lives.
Yeah.
And they're still they can't seem to get over that hump. Now, with bariatric plastic surgery, or what we're talking about, post-massive weight loss body contouring surgery, it's a mouthful to say, I know, but this is the new field, the new kind of the new burgeoning subsection of plastic surgery, which will eventually take over all of plastic surgery, I think. I mean, obviously, there's always going to be different things, cleft lifts and palates and, breast augmentation and BBLs and such. But the amount of obese people in the world and the amount of, just by dint of statistics, the amount of people who are losing massive amounts of weight in the world is going to increase so much that we're going to see a lot more of these kinds of cases. And you really have to think of the massive weight loss patient as a different kind of patient because, again, you have to recognize what the problem is. The problem is that we have excess skin, and usually in the full circumference of the body or completely along the whole limb, the upper and the lower limbs, of course. But surgeons have to kind of step up to the game. Us plastic surgeons, we have to step up to the game and realize that there are issues that may not have been there, compared to some of the other plastic surgeries that we are taught to do in plastic surgery fellowships, which don't really involve that. I'll give you an example. Let's say a straight up breast augmentation on a 22-year-old young lady who just wants her breast size increased. Well, that doesn't take any knowledge of obesity and massive weight loss and consideration of all the loose sagging skin. Now take that 22-year-old young lady, and let's say she lost 80 pounds after taking Ozempic for 6 months, or having a bariatric endoscopy, for example. And now you're talking about a whole different set of terms that you have to deal with, because there's going to be excess skin. Not only on the breast, there's going to be deflation just from losing the weight, but there might be excess skin along the thoracic roll. Maybe you're extending into what you may need to do is an upper back lift, or what we call a thoracoplasty, or thoracic roll lift on the side of the chest over here. So, in answer to the question, I see patients from all over the gamut. I see them when they've lost 200, 250 pounds sometimes, which is hard to imagine. You take I'm not even 200, when I'm in amazing shape. And imagine a guy like me that you just dropped off like a bad habit.
Yeah.
And it's amazing to see how people are, they're all over the place. And yeah, I just recommend to patients, look, there's no right time to do the surgery unless you're ready for it, right? Whenever you're ready to do the surgery, you always have to do the proper assessment, consider all the risks, the benefits, of course, the alternatives to doing it. And as long as you're working with a board certified plastic surgeon, and not only that, but a body contouring expert, someone who's done a whole bunch of these massive weight loss body contouring procedures, then you're going to have the right strategy in mind. And that's really what it's all about, is getting the right plan, the right strategy, a staged strategy for your overall body restoration. I call this kind of surgery, another mouthful over here, but you can have, I guess I have a knack for fancy words here. But for me, all of these surgeries can encompass in this. It's a circumferentially corrective, reductive restoration of the body. So circumferentially, of course, we always have to consider the body in 360 degrees, because all the body parts are connected, of course, and you're not just doing a tummy tuck. I have my patients, when I'm marking them for a tummy tuck, or when I'm evaluating them, they're like a little ballerina doing pirouettes back and forth. And sometimes they tell me, though, Doc, we're not working on the back. Why are you looking there? And I say, I'm a 360-degree surgeon. I'm always evaluating everything, because it's going to be a circumferentially corrective surgery. Now, reductive restoration, because we're taking away all these excesses of life, the wear and tear of life, and specifically obesity, massive weight loss. You're going to have folds of skin everywhere. So we have to reduce, and that's how we restore your contours. That's how we rejuvenate the body, by taking away. Now, obviously, we can add some stuff like breast implants, like mesh, and different kind of things, but the majority of it falls in line with a circumferentially corrective, reductive restoration.
Yeah, because this is, what is it? The knee bone's connected to the thigh bone. We learned that a long time ago. It's all connected. Now, someone just asked, what do you consider massive weight loss? 50 pounds more? What do you like? What, yeah. Or is it just the way their body gains and loses that weight?
Right. It's always about, the individual patient. But as I said, the classic definition was 100 pounds or more, or 40% of your total body weight lost. These days, a lot of surgeons like myself consider 50 pounds or more as massive weight loss. But I'll tell you what, if someone's 4'11" and they're 110 pounds, barely 100, and I could tell that there's a lot of loose skin, and I ask, hey, have you, I always ask people, well, how tall and how much do you weigh? And then I say, have you gained or lost weight in the past year or two? And if they tell me yes, even on a patient I just described, 4'11" and 100 pounds, if she lost 30 pounds, that's massive weight for her. And you can tell the effects are there on the skin. You can see that there's laxity, there's the stretch marks, there's the loose sagging skin in all aspects of the body. And yes, I can deem that patient a massive weight loss patient, just as I can deem someone else who's lost much more weight, but in a different body.
Well, and also, like, one of the things that you were talking about, like when I started reading about you, So when I was 26-ish, I lost 75 pounds post baby.
Wow.
But I went into a bikini after a year, like, because it was over a year
Your skin, yeah.
and my skin was fine. Like, I was lifting every day, working out, eating healthy. It was very, very gradual, and it was due to those things. You are seeing a difference with the people that are doing the GLP-1s, that their body is reacting to that weight loss in a different way. And that is when you're coming in, because you're seeing that affects the body differently. These GLP-1s, the weight loss surgery, it's different for those people.
Yeah, I mean, everyone gets affected in different ways. And, again, going back to the GLP is just the latest craze, but there's going to be a lot more of everything. The thing with GLP-1s, the Ozempic and Wegovy, I mean, I say to get a good segue into that now, because, people ask me about that all the time. And I see people on it all the time. And not only those, but there's a bunch of new class of medications that disrupt the appetitive behaviors that we have, in our brain-gut axis there. Exactly right. But these drugs are incredibly effective and they're great. But you know what? Oftentimes, without that change in the mindset, without the change in the appropriate lifestyle modifications, the proverbial diet and exercise, the two words I hate the most in the English language, because what do they really mean to anybody anymore? But without those effective changes in those lifestyle modifications, a lot of people have a bounce back after they stop taking the GLP-1s for one reason or another, whether it's too expensive, whether the side effects are too much to bear. So we find that a lot of people have this kind of roller coaster yo-yo life of going back and forth. And I see that all the time in my practice. And eventually a lot of them have to go back into good old bariatric surgery, the bypass or the sleeve gastrectomy, or even the lap band, which some people are still doing. Or, as I mentioned earlier, the new revolution in procedural obesity management, which is bariatric endoscopy, which is actually accomplishing a sleeve, just like a gastrectomy, but doing a sleeve gastroplasty through an endoscope, meaning you're actually doing an endoscopy where it's not real surgery. It's just, when a gastroenterologist and a specifically trained gastroenterologist puts a tube down your throat and through the esophagus and into the stomach, the actual organ in the abdomen, and sutures up the stomach to effect a sleeve from the inside, which is actually the outside of the body. That's kind of a strange, kind of a abstract thought experiment to think of, but we're doing weight loss. It's not surgery, it's endoscopy, with the simple procedure. So we're going to see a lot more weight loss through all these different methods. And, every now and then I see people who just told me, I just stopped eating, doc. I just decided, I got back into the gym and I worked out and got the weight off. So even with conventional methods, we see all kinds of different modalities of getting to that weight loss goal. And oftentimes it's a lot of combination of both. Some people tell me that, well, I did a sleeve endoscopically and then it didn't work. And then I went to my surgeon and then we converted to a bypass. Or I did a sleeve gastrectomy with a surgeon, which an actual surgery, and then we converted to a bypass or some other kind of biliopancreatic diversion, which is an even more kind of effectual weight loss maneuver. A lot of people get in or on and off the medications. And again, they all have to get some kind of lifestyle modifications to make sure that the weight loss actually sticks. So there's going to be a whole lot of this. There's a new wave coming. And again, just by statistical numbers out there, 2/3 of Americans at least are overweight and or obese. 10% of us are morbidly obese, which is a BMI which is not a perfect measure of obesity, but again, it's a rough measure. Yeah. BMI of 40 and above. And you're talking about 1 out of every 5 children in America, children and adolescents, are obese. So we're going to be seeing a lot more of this. Like I said, this is the new frontier in obesity treatment, in bariatric plastic surgery. We're here. The future is here.
Yeah. It is amazing. I even said to my one of my kids, I was like, "You're craving sugar way too much. I'm watching you just like really." I'm like, "We need to get your sugar tested and see if there's some sort of insulin resistance," because I'm watching. Like, I'm a sweet person. Like, last meal, donuts and blueberry pancakes. That's me. Like, I'm not a chip girl.
But I do. For me, so.
but I recognize like that sugar craving and all of that. And so what like what do you suggest for people? Like for me, I paid for my surgery with Care Credit. I know that's an option for some people. A lot of this stuff is very, very expensive. Does insurance cover the skin reduction? Like how, like what do you see? How do you talk to your patients about paying for these? I mean, if you're having your from your top of your head to your toes basically done, that could be hundreds of thousands of dollars.
Yeah, yeah, absolutely. So insurance, yeah, that's a kind of that's a touchy subject there because insurance doesn't really cover for any of these operations. And when they have to be done, they all have to be done in a cosmetically pleasing way because if you're doing it just to cut off excess skin and the scars end up in very conspicuous places, I think that's even
Yeah.
worse than not getting the surgery at all. Best if you're going only by what insurance covers, let's say insurance would cover a surgery that's called a paniculectomy, cutting off just the abdominal pannus, which is the area in the lower abdomen between the umbilicus, the belly button, and the mons pubis, what most people will call the vagina, but it's not. It's the hair-bearing portion, the pubic hair, of course, above the pubic bone. So that little triangle that we want to see, that's the mons pubis. So the area of skin between those two, the umbilicus and the mons, is called the pannus. When we do a paniculectomy, the insurance will just cover for cutting it off, and that's it. So you get a transverse scar. No good. The belly button gets pulled down. It looks awful. I haven't done a paniculectomy in God knows how many years already. It's an awful operation, but that's the only thing that the insurance will cover for. They won't cover for the transposition of the belly button, which is the essence of what a good, properly done tummy tuck needs to do. So that's one of those things where I say, you know what, just don't even bother with it because they're not going to pay for something nice, something you'll be happy about. So don't do it. Let's take breast reduction for another example. Well, that's a good place where insurance does cover and covers it appropriately. Anytime you do a reduction, you absolutely must do a lift. It's when you do a lift that you don't have to do a reduction. But that's another discussion right there. But if you're getting a breast reduction covered by insurance, then great. That's a great way of using your insurance. Now, if you want to continue it into a thoracic row lift or getting some liposuction done on the thoracic, on the sides of the chest, just to get better contours, well, you may have to pay for that on your own, out of your own pocket. Now, when we're talking about arm lifts, thigh lifts, and total body lifts, I've never had any insurance company pay for that. And you know what? For good and for bad with regards to that. I think that, the bad thing about it is that, yes, okay, a lot of people are discouraged because, okay, doc, I don't have the money. My insurance would pay for it. I'll do it if my insurance pays, and that's it. And unfortunately, that discourages a lot of people from getting the surgery. On the good end of it is that, okay, well, you're not relying on your insurance, and it puts all the onus and responsibility on you, which makes you a better patient because then you choose your operations with more discernment. You actually you're actually figuring out the strategy. Like I said, that's what it's all about. It's figuring out the best surgical plan, a staged surgical plan so that you hit the issues that you need to hit the first and foremost, and then you live to fight another day. You address all the other concerns with the other body parts in a more concerted effort. And you know what? When your own microeconomics go into it, I think you tend to make better decisions about it. So the fact that an insurance company isn't covering the vast majority of these cases, again, you could look at it from both ends, for good and for bad. I think time will tell what insurance companies will do as more and more of these operations are being done and more plastic surgeons and patients end up really kind of reconsidering the fact that these procedures are part of healthcare. They're not just cosmetic. I refuse to agree with all the naysayers. Oh, it's just cosmetic for, you're just doing it for vanity. Absolutely not. You're restoring someone's ability to live a normal life. And you know what? It's a lot easier to go out and work out when that abdominal pannus, when that, big tire around your waist, not my words, patient's words, by the way, when you remove that, when you don't have the floppy bat wings, again, not my words, my patients, descriptions of their body parts, but it really does make a difference when you're able to get rid of all the loose, sagging skin and you improve the hygiene, you improve the ability to do the very things, the lifestyle modifications that are necessary for maintaining that weight loss and doing those health habits upkeep, then yeah, you realize it is reconstructive in nature. How insurance companies will handle this, only time will tell.
Yeah. Well, and I know you've seen it. We have TV shows about it. We have make-believe TV shows about it. Let's talk about really quick before I know you have to go back and do another surgery because that's what you do. The botched, like these botched surgeries that people like go in and they think that they're with a plastic surgeon. They're not. This person, like you said, like this is not a boob job. This is not a cleft palate repair. This is not fixing your earlobe from your earring going through. This is major surgery where you're taking large portions of your body and removing it, putting it back together, making it so that you like I had a heparin shot before I went in. The squeezy things on my legs while I was under anesthesia to make sure that I don't get blood clots. Like this is a major, major surgery. I was down for the count for 10 days before I started to even come down into the kitchen. It's important that the person that you go to knows what the hell they are doing so that you are not botched. I know a lot of people like they want to go to Mexico to get this done because it's, $4,000 cheaper. And I am here to tell you, your belly button, that is a artist work. When you're having these incisions done, don't even bother if you are going to someone that is not an expert, because if your belly button gets botched, if your scar is botched, that is not going anywhere. That is with you forever. So the very thing that you are going into surgery for, which is to look better, is now you look worse, technically. So can we talk about these people that are going to other countries and are going to people that are not board certified to save maybe even half? Maybe it's a $10,000 surgery and they're getting it for $5,000. That $5,000 that you save over the course of the next 40, 50, 60 years of your life.
Yeah. All right. So let's talk about, there's a lot of things we can cover there, but bariatric plastic surgery, that post-massive weight loss body contouring surgery, has produced some of the biggest, longest scars ever known to mankind. I mean, you look back at the history of surgery, and I'm a kind of a buff with that. I have books written about plastic surgery 150 years ago, and even further back than that. So we're going to talk about, okay, how do you choose your surgeon? How do you know that you're making the right choice with the person you're going for, where you're going to get the surgery, and so forth. Going to different countries. Look, I don't want to disparage other surgeons in, as you mentioned, Mexico or the Dominican Republic or these other countries. I'm sure they have wonderful surgeons there. And, listen, God bless, they do some good work out there, but you just don't know about their standards of accreditation and qualification for doing these surgeries. And it's just not the same as the United States. Now, thankfully, there's a lot more surgeons in the United States that are doing this kind of work, and the prices have gone down considerably. I can tell you my prices in Miami are some of the best prices you can find in the country, and it doesn't have to be that expensive. Now, let's talk about what kind of surgeon you need to do. Let's say you lost 100 pounds after gastric bypass. You're looking for the right kind of surgeon. The first step is you got to choose a surgeon, a real plastic surgeon who's certified by the American Board of Plastic Surgery. You can go on their website right now and type in their name, type the state that they're in. You can even call the board and say, hey, is this surgeon certified by you? Are they in good standing? And you will get a quick answer. That's your first step, because that's the only way you know that they've reached the milestones that are necessary to at least be able to have the training and education to do these kinds of surgeries. And again, there's a series of operations or series of tests that you have to go through, and the proper training. It takes years to become a board certified plastic surgeon to be able to say that. And if you can't say that, then you're getting someone that's maybe not as qualified. Now, people often go to cosmetic surgeons. That's one of the big things out there. Well, cosmetic surgeon is any physician who has gone under a training of cosmetic surgery for 1 year under another cosmetic surgeon. You could be a pediatrician or an emergency room doc or a gynecologist and do a 1-year fellowship, with another cosmetic surgeon, and then go out there and start doing some lipo. And lo and behold, you're a cosmetic surgeon. And look, listen,
That freaks
I have
me
a lot
out.
of
The
friends.
idea of a pediatrician doing liposuction. That just like, oh
It
God.
happens. It's out there. I've seen it. Now, look, there's some, and now again, I don't want to disparage all of them. There's some cosmetic surgeons who, did general surgery before they did a cosmetic surgery. And some of them are actually pretty good. But that's the whole thing, is that you just don't know what the standards are for their qualifications. Now, beyond that, so let's say you found a board certified plastic surgeon. Now, what you want to make sure is that they've done a whole bunch of these specific kinds of surgery, the post-massive weight loss body contouring surgery. How do you know? How do you check that out? Ask them to pull their phone out or their iPad and say, hey, the operation that we're going to do, the body lift that you say that I need, how many of those have you done in a lifetime? How many of those did you do last week? And if the answer isn't in the hundreds for the former question, and then maybe a couple or two or three or five for the latter question, then maybe you're not dealing with the right kind of person. And I know that, when patients come to me and they say, okay, what kind of surgery could we do? And I say, okay, we could do an extended tummy tuck or maybe an FDL or a belt. And then they say, well, what does that look like? I just pull out my phone and and these days it's so easy. And in my HIPAA protected files, it's all password protected, of course. And obviously I maintain patient privacy there. There's no pictures of any faces on my phone, only my babies, that's the only faces you'll see there. And my wife, of course. But, I just flip through my phone and I say, here, look, this is a lady who's about your height, lost a similar amount of weight. Here's what I did with her. Here's what she looks like on the table. Here's what she looks like 3 months out. Let me find, the right timing and, make sure that I can show you. Or here's another patient that kind of looks like you and similar body parts, and she decided to do something different. Here's how the corners, turned out, and so on and so forth. So you have to make sure that you're dealing with someone who's done a whole bunch of these. And again, I go back to this strategy point. Your surgeon, your board certified plastic surgeon, your body contouring expert has to be able to come up with a surgical plan for you so that they're doing surgery that is conducive to the next and the next again. I like to tell my patients that I operate into the future. Now, what does that mean? If, let's say, I say, well, look, you can have a belt, no problem. But then they tell me, you know what, doc, I don't have the money for it. Or I never thought I'm going to have a circumferential scar. I'm just a little scared of that. Let's just do the extended tummy tuck. I tell them, no problem. I can do the belt in 1 or 2 stages and I'll make it look absolutely the same. How do I do that? In my design, I make sure that I avail you of the option of continuing on to do what I call the completion belt lipectomy. So again, you're going to do the extended tummy tuck or the FDL with a vertical scar, FDL extended tummy tuck. And the corners of the tummy tuck are going to be placed at exactly the right spot. The line, the scar will always be along that line of the bikini, what we call the inguinal canal, which is, or the crease rather. And that by the fact that the incision will be placed there, the corners of the incision will never point down, will never point up, meaning that if ever we come back to complete the belt, then the corners will be laid out perfectly so that the next surgeon, hopefully it'll be me, but even if it's not, that surgeon will have a moment in their life when they're marking you up and then they'll look at the backside and say, holy smokes, look at the corners. They're just perfectly aligned. It's almost as if someone knew that I was going to be here today. No, it's not almost. It's by design. I design my scars to be conducive of the next surgery so that we can continue on and do more and more. And how far we want to go, we want to, take the train. The patient decides how many surgeries do we want to do. It's all in the patient's hands, and it's always there for the taking. And by the way, with that little example of doing the, just the extended now and coming back for the completion of the belt, hey, I'm going to do a bunch of liposuction there anyway. If I'm lifting the buttocks in the second stage, why not put a little fat grafting in there and get a nice BBL, but not just a BBL. What I call BBL is Brazilian butt lift, but a TBL, what I call a true butt lift, because then you're not just stuffing fatty tissue in the buttocks with lax tissues where it's going to fall down, but you're lifting the buttocks and fat grafting. It's a great option. Again, when you operate into the future like I do, you're always availing the patient of more options and more tweaking of the body, because you know that their body image will adjust and will change with time. And whatever they want to do next, they're going to be able to do it and move on. And hopefully, if they want to continue to that full body restoration, sometimes it takes 3, 4, even 5, 6 operations to get it done. But we do it in bite-sized chunks. It's the safest, it's the cheapest, and it's the best way to do it. So that's how you pick a surgeon. You know that's someone who's going to be able to give you all the options and get a nice total strategy on the first time that you meet them, and then be able to adjust the strategy from there on.
Well, I have to tell you, Dr. Kaufman, this has been so awesome to talk to you, but I have to say, I have one regret with my plastic surgery. It's a big regret.
Oh no, tell me.
I wish I would have done it sooner. I do. I wish I would have done it after my last kid, because I waited. So I'm 52. My last kid was 39. So 13 years. I really wish I would have lost that weight after the 4th baby and had a plan. It kind of makes me emotional. Oh my God, that's so weird. I never.
You're getting emotional. You're gonna get me emotional.
I just got emotional thinking about, like, oh my gosh, I wish I would have had a plan. I wish that, maybe people will listen to this and just say, okay, I know this is my last kid. My husband had a vasectomy and I'm going to lose this weight. I'm going to save my money. And this is what I want to do, and put myself first. But as a mom, I've been a mom now for 29 years. It's just not in the forefront of my brain to put myself first until I hit 50 and had cancer. And then I was like, wait a minute, I'm allowed to have a life and a body too. And my insurance, like I said, covered my breast lift because of breast cancer. That kind of gave me a pass that was like, okay, you can do this. You had cancer. This makes sense. And then with the tummy tuck, it was like, no, it doesn't just make sense. I'm allowed to feel good. I've given my body to my children for decades now, between feeding and having them. I wish I would have said, I'm done with having children. I've fed and grown babies inside of this body, and this is my plan to lose weight for 1 year. And as soon as I'm done doing that, I'm going to do these things for myself. And I just didn't think of it that way until I had cancer, and someone else told me that I was worth having that surgery.
Yeah.
And that's what happened. Someone else told me I was worth it. And then I believed them and had the tummy tuck.
Yeah, it's funny you said that. It gets me a little emotional too, because I wish that people looked at plastic surgery in a better light, because it's not just vanity. It's so unfair to put people in a box and say, oh, these are the reasons why you're doing it. These are your motives. And people's motives and people's emotions run so deep, and everyone's dealing with a different kind of trauma in their lives that they have to overcome. And for me, if plastic surgery, reconstructive, cosmetic plastic surgery, whatever you want to call it, if it can be part of your healing, part of your journey to restoring your confidence, you're restoring your personality. And, I've seen people blossom so much as a result of the surgeries that I've done for them. Then by golly, you got to give it up and say, plastic surgery is healthcare. Let's not deny it anymore. And enough with all this, kind of negative outlook on plastic surgery. I'm a proponent of it, until the day I die or I can't do this anymore. This is it's truly an honor to be, people's doctor and to be their plastic surgeon. It's a privilege for me, and I just love doing it. And I see I'm getting a little bit emotional because I've seen, I wish I could go on and tell people about all the different stories that I've heard of overcoming adversity and just conquering internal demons. And for me, it's a joy, it's a privilege. And again, it's an honor to be a plastic surgeon for the people I can help out. And and it's just, it's a great place to be. And I love doing it. And, I go back, every time I when I wake up, it's always dark. When I go home, it's usually dark as well. But, I go back home with a smile on my face. It doesn't matter how hard the day was and how tough the surgeries were that I did that day, but it's a privilege and I love doing it. So plastic surgery all the way.
Well, I know, I woke up this morning and I got dressed and I looked in my full length mirror and it was like, wow, and I didn't do that myself. I had someone help me. I had a plastic surgeon help me with that. And so thank you for the work that you do. If someone is interested in working with you, I have people from around the country, actually around the world, that listen and watch, and they want to work with you. How does that work with you being in Miami and this person being in, Kansas and Pennsylvania and wherever that's not by you? Do you organize travel, like places to stay? Because like I said, I was not out of bed for 10 days. I would not want to get on an airplane after a tummy tuck.
Yeah, so people come to see me from all over I say all over the United States, but all over North America and the world for that matter. But yeah, absolutely. People can arrange for all the logistics of traveling for surgery, depending on what kind of surgery we do. And again, I limit most of my surgeries to practically all of my surgeries are less than 4 hours. I do it in bite-sized chunks. We do things that we can manage. Surgery that's ambulatory. You can walk in and walk out of my surgery center. And yeah, so people come to see me from everywhere. They arrange for logistics, for staying at a hotel, Airbnb, or recovery house. I urge people to come with a surgical buddy, make sure that we communicate with, I communicate with doctors back at home, make sure we get all the, all our T's crossed and our I's dotted, and we get medical, clearances and all that stuff. My team here in my practice, they help me arrange all these things prior. I do consultations before that. I take a look at pictures all the time. My phone is practically blown up on, I want to say on a daily basis, but on a minute by minute basis, my coordinators send me pictures and, okay, she wants this and that. And I say, okay, let's do this. Let's do that. Let's not push the envelope too much. Always with your safety first and foremost in mind. And again, I try to do as much as I can for people with the time that we have. Mostly people stay here for about a week, sometimes 2 weeks. The more time they stay here for me, the better off it is. It allows me to be the doctor and take care of any little issues that come along the way. And there are always issues when we do surgery. We can't think of, this doesn't go just perfectly according to the plan. There's always things that we need to deal with. And even beyond that, when they go back home, sometimes with drains, sometimes with other things that we need to manage, I communicate with the doctors back home. A lot of people have friends who are nurses and, people who can help out along the way. And again, as long as we have good communication with my patients, which I do wherever they are all over the globe, then we can make surgery happen. And believe me, if I see that it's too dangerous or you're asking too much, I have no problems in saying it and saying, listen, we got to cut it down. We got to limit what we can do. As long as we stay safe and smart, I think we can accomplish anything. And yeah, as we said, people come to see me from everywhere. We help them arrange all the things that they need for surgery, like logistics and staying around here and getting the massages done and getting the drain care and all that kind of stuff. And yeah, it's doable. And traveling for surgery, isn't, as frowned upon as it used to be anymore. And, in large portion because we do it so much better and safer these days. So yeah, absolutely. You can find me here in Miami and, yeah, I'm here. People come to see me from everywhere. It's kind of fun, actually. I always play a little game with myself when I see their phone number and I try to, I guess where they're from. And these days, I know all the Chicago numbers, Houston, LA, Cleveland, Atlanta. But it's funny these days. I know Bahamas. I got a community down there that follows me, and Wisconsin, Canada, and even beyond that, even international numbers. But anyway, I could go on. But people come to see me from everywhere, and we get it done safely and in a smart way, so that we can continue the work of improving people's bodies.
All right. Well, everybody, go check out drdanielkaufman.com, and
that's where you can find me. I got a bunch of social website. I got a Instagram. I got a couple of pages on that, and TikTok. You can find me everywhere. Just www.drdanielkaufman. That's KAUFMAN.com. drdanielkaufman.com. That's my website, and all my socials you can get through there.
All this stuff is there. Well, thank you so much for spending time with all of us this morning and answering all of our important questions about weight loss surgery and all the things. This has been a great morning for me, but I'll see all of you guys here next week. Thank you, Dr. Kaufman, for being here, and have a great week, guys.
Take care.
Thanks for listening. If you would like to connect on a more personal level, head over to meredythwillits.com or on Instagram at Meredyth with a Y for behind-the-scene footage and outtakes. Please subscribe and come back each week for more Meredyth with a Y. Thanks again.